Access to healthcare for the uninsured and underinsured. Good afternoon, ladies and gentlemen. Thank you for giving me the opportunity to discuss the issue of healthcare access for the uninsured and underinsured in our country. In this presentation, we will describe healthcare access for the uninsured and underinsured. We'll also look at the extent of this issue, who it affects, and the negative consequences of it. We'll discuss the key policy level problem, and we'll look at the policy alternative that I recommend for addressing this problem. We'll also evaluate the intended effects of this policy alternative and justify why this is the best policy alternative. So what is access to healthcare? Access to healthcare means having the timely use of personal health services to achieve the best outcomes. Clinical experts mention that access to timely and appropriate healthcare services may help patients to prevent illness and control these illnesses. Uninsured and underinsured individuals are less likely to have a regular source of care, and when they do receive this care, it is poor quality of care. These individuals are also likely to report poor management of chronic conditions. A healthy lifestyle entails regular visits to the doctor to make sure that there are no pre-existing conditions that may affect one in future. But being uninsured or underinsured causes health problems due to expensive costs associated with preventive services. The demographics related to access of healthcare. In 2018, 24% of Hispanics did not see a doctor because of cost concerns. 21% of blacks did not see a doctor because of the same concerns. 19% of American Indians did not see a doctor because of these concerns. 15% Native Hawaiians did not see a doctor because of the same concerns. 14% did not see a doctor. Of whites did not see a doctor because of cost concerns, and 11% Asians did not see a doctor because of these concerns. So this issue does affect different groups, however some are affected more than the others. The negative consequences of this issue. The uninsured and underinsured live unhealthy and die younger than the insured due to lack of access to necessary health services. Approximately 18,000 people each year die from a preventable disease because they lack health insurance. Uninsured individuals are more likely to have diseases diagnosed in the later stages, which can contribute to premature death. People without health insurance also may not receive the routine preventive care that could help them avoid illness. Additionally, they are nearly 50% more likely than those with insurance to die of traumatic injuries. Uninsured patients are less likely to receive operations or rehabilitative therapy and more likely to die in the hospital. Inadequate medical care of the uninsured also has public health implications. When infectious diseases go undiagnosed, untreated, or insufficiently treated, for instance, affected patients serve as reservoirs of infections for the larger population, which can lead to disease outbreaks that reach epidemic or even pandemic proportions. So what question can we ask ourselves? The question that we can ask ourselves is, what can be done to secure access of healthcare for the uninsured and underinsured in our country? Should we copy healthcare systems from other countries like the UK or Canada that use a single-payer system or universal healthcare? Should we look at our own policies that have been put in place and reevaluate one that might work? Should we create something new that will help with this issue? These are some questions that we can ask ourselves. But what do I think? The policy alternative in addressing this problem, I think that we should revisit one of our policies that has been implemented before, and this is the Affordable Care Act. I know that this is not a new alternative. However, we can make changes to this policy so that it suits the needs of all stakeholders involved. My reasons for saying this are because of the successes that this policy had compared to the failures and other policies implemented before it. Some of the successes include the fact that in 2008 to 2017, the numbers of those uninsured dropped significantly. In 2008, 17.1 million individuals were uninsured, and the numbers dropped to 10.2 million uninsured individuals in 2017. In 2016, 1 out of 10 did not have access to health insurance, meaning that 91.5% of Americans were enrolled with a health insurance provider under this policy. In 2017, 73.8 million people were enrolled in the Affordable Care Act Medicaid insurance program. The intended effects of this policy alternative, the intended effects of the Affordable Care Act were to make sure insurance was affordable for more people. Through the Affordable Care Act, statistics indicate that the program offered premium tax credits, which lowered the cost of healthcare services for people on poverty level. Second, its intentions were to expand the Medicaid program. This Medicaid was to help cover medical expenses for adults with an income below the U.S. poverty level. Lastly, this policy supported research and development of change in medical care. So this program attempted to lower the cost of the U.S. healthcare system. So why do I believe that this is the best policy? We all know that the Affordable Care Act was not the first health policy initiated. However, it has helped a lot of individuals who didn't have healthcare coverage to acquire it compared to the other health policies initiated before it. Instead of changing one policy to the next, I say let us concentrate on what we already have and make changes where changes are needed to suit the stakeholders involved. We are aware of the Affordable Care Act and of its successes and failures. I say let's adjust it to suit our healthcare system and help all those who are uninsured and underinsured. I conclude by saying that instead of trying to find one solution to the next for our healthcare system, I say let us build on what we already know by making changes where changes are needed. The Affordable Care Act is a potential health policy program that can work to the favor of all stakeholders involved if it is adjusted in a just way. By making changes to this program, we can hope that it will help the uninsured and underinsured to access healthcare so that they too can live and thrive like those who are insured. Thank you, ladies and gentlemen, for your time. Have a great afternoon.